Hi, this is Linda Shea with Drilling Contractor. I'm at the 2019 IADC Drilling HSE&T Europe Conference in Amsterdam, and I have with me Dr. Jonathan O'Keefe, who is Corporate Medical Director for Sidras. Jonathan, thank you for being here.
Very nice to be here with you, Linda. Thank you.
So as a medical director, what is the key message that you would like to share with the IADC audience?
I'd like to make sure that healthcare and fitness to work gets a prominent place in most organizations. And what we tend to see is that a lot of organizations invest very heavily in safety controls, and they're very conscious of the possibility of accidents related to injuries, but not necessarily as conscious about how medical problems can cause sickness absence and can cause a lot of burden of disease offshore and can impact on productivity as a result.
So what is the business case for investing in fitness to work offshore?
We have an industry standard called OGUK, which is a good standard, but a lot of illnesses and conditions are not detected necessarily by the OGUK standard. Things like diabetes, severe cardiac risks, infectious disease risks such as tuberculosis and so on. Those things can leak through our current industry baseline standard. And it's great that we have a compliance standard, but it really is imperative that we rise to a higher standard. In my opinion, we could be improving productivity as a result. At Sidras, for example, after implementing this, we managed to save in our first year 21 medical evacuations off of our platforms globally. And that was 21 people who returned to their family to have Thanksgiving or Christmas lunch with people they care about, colleagues of ours who we believe are important to our organization, whose experience we wish to retain in the long term, and an overall burden on productivity that we relieved as a result.
So what is the difference between investing in health and medical versus investing in safety for our industry?
We know that organizations have in oil and gas industry a high risk environment for injury. We know that slips, trips, falls, dropped objects, etc. can have a terrible impact on people's health. But what we neglect really as an industry is the idea that when people come offshore with high cardiovascular risk, with obesity, with dental problems, with infectious diseases such as tuberculosis, which are active, that we can actually make a big difference to the people and to the productivity and to the bottom line of our organizations by looking after this.
So at Sidras, how did you tackle the issue of medical illness offshore?
We started with the 2015 baseline study, and we looked at all of our topside disembarkations, and looking at the number and the quality of those disembarkations, we looked to see how many of those would be preventable by a higher fitness standard. And on doing that, we were able to see that about 15% of our medivacs, our disembarkations due to a medical problem, not due to an injury, would have been prevented by a better screening program. And that included things like heart attack and stroke. We had some individuals whose blood pressure was 180 over 110, which is severe hypertension, undetected with no symptoms. We had people with uncontrolled diabetes, blood sugars that were raging that were leading to potentially cardiovascular events again. We had a couple of individuals with suspect cases of tuberculosis, all detected by this higher standard that we put in place in 2016, and the results in 2018 speak for themselves. We now have a program that returns $1.3 for every dollar that we invest in it in terms of health and fitness for work offshore, and we have saved over 44 medivacs in a 3-year period, where we can say that that person has come back intact in almost a better medical condition than when they went offshore in the first place.
Well, thank you so much for being here, Jonathan. It sounds like you're getting great results from your program.
Thank you for having me, and I hope that as we progress that we can continue to focus on safety and medical together.
And thank you, viewers, for joining us on drillingcontractor.org.